Hi, my name is Brad Thibodeau, and today we're going to present information on celiac disease, non-celiac, gluten sensitivity, tropical sprue, and gluten sensitivity intrapathy. We're going to do a quick compare and contrast on all the disorders before we get into more detail presented by my other group members. We'll start with how they're all contracted. Tropical sprue is contracted in tropical regions, and it's a bacterial infection of the intestine. Celiac disease is an autoimmune disorder of the small intestine, occurs in genetically predispositioned people. Gluten sensitivity intrapathy is genetically contracted, and non-celiac gluten sensitivity is by the ingestion of the protein gluten in the diet. Tropical sprue includes symptoms of diarrhea and anemia. Celiac disease is diarrhea, osteoporosis, anemia, dermatitis herpetiformis. Gluten sensitivity intrapathy is anemia, diarrhea, and growth issues. Non-celiac gluten sensitivity is irritable bowel syndrome and fatigue and headaches. All cause damage until the intestine villi except for non-celiac gluten sensitivity. Treatment begins with tropical sprue, is antibiotics and folic acid. Celiac disease is a strict gluten-free diet. Gluten sensitivity, strict free gluten-free diet. Celiac gluten sensitivity is strict gluten-free diet. And next, Sarah is going to go into more detail on celiac disease.
So celiac disease is an autoimmune disease characterized by chronic inflammation of the small intestine. The lining in the small intestine is damaged by the protein gluten, and gluten is a protein found in wheat, rye, and barley. And gluten is composed of two proteins in itself, gliadin and gluten. And gliadin is the problem here because it is the soluble protein in gluten, and it causes damage to the villi in the small intestine. The villi is the hair-like projections in the lining of the small intestine that are responsible for absorbing nutrients into our body. So a person with celiac disease cannot consume gluten-containing foods. This is just a diagram of the small intestine and the villi, and like I said, the villi is the lining in the small intestine and it helps absorb nutrients. So celiac disease affects about 1% of the United States population, and this is due to genetic, environmental, and immunologic factors. With genetics, if an immediate family member has celiac disease, then the chances of another family member receiving this are 1 in 22. And then patients that are more susceptible than the normal patients for celiac disease are those who have already been diagnosed with diseases such as type 2 diabetes, thyroid disease, Sjögren's disease, microscopic colitis, autoimmune liver disease, osteoporosis, and anemia. With the assessment, it is kind of difficult to detect at first if the patient has celiac disease, and that is because less than 50% of patients have normal GI symptoms. Most of the patients show more nutrient deficiency symptoms, and as we know, some of those can be underlying. But children mainly experience symptoms such as vomiting, diarrhea, weight loss, failure to thrive, anorexia, protrusion of the abdomen, and wasting of the buttocks. And then adults and other individuals with this disease, you will see signs such as abdominal pain, chronic diarrhea, dental ulcers, fatigue, weight loss, and nausea. And then with celiac disease patients, you will also see iron deficiency with or without anemia, and you can see a premature onset of osteoporosis. These two are both because that the villi is being damaged, so adequate nutrients are not being absorbed in the small intestine. You can also see dermatitis herpetiformis, and that is a skin rash due to the reaction to gluten. The onset may occur at any age, and the screening is done with blood tests. Ideally, it's the IgA-TTG blood test. This is immunoglobulin A and tissue transglutaminase antibodies test. This test screens for celiac disease antibodies, and these antibodies are IgA and IgB. Although IgA test is more common because the IgA antibodies are made in the small intestine, and that's what we need to be looking into to see if the patient has celiac disease. Although there's a gold standard test, and it's the esophagogastroduodenoscopy with small intestinal mucosal biopsy. This is a biopsy that is run, and it shows the entire picture of the lining of the small intestine. Although this is the gold standard, it's not ideal for most patients because it is very costly. With this biopsy, you will see mucosal villus atrophy, and that is when the villi have basically sunken in and they're not standing up anymore, so they can't absorb the nutrients in our body. The only treatment for celiac disease is to follow a strict gluten-free diet. Now this will be eliminating wheat, rye, and barley products. And the disease can't be cured, but it can be managed through the strict diet. Also, it's advised to take dietary supplements for different vitamins and minerals because the villi is damaged. So some of these are iron, vitamins A, vitamin B12, D, calcium, zinc, and magnesium. And then some patients need to look further into a lactose-free diet, although this should only be temporary. With the nutrition assessment, you'll see the signs and symptoms that I pointed out earlier, such as diarrhea, abdominal pain, other GI symptoms. Patient will also test positive for the IgA-TTG blood test. The biopsy will show damage to the patient's lining of the small intestine, and the patient could have an immediate family member with the disease. Right here I'm just going to show you a few gluten-containing foods and gluten-free foods. Some I wanted to point out that some people might not realize are your dressings, like salad dressings. A lot of them are not gluten-free. Stuffings, like for your chicken or turkey for Thanksgiving. Beer definitely has gluten in it. And then gluten-free foods, you'll get your fruits, vegetables, dairy products, meats. So you're not cutting out everything if you're gluten-free. Now Claire will take it away.
My name is Claire, and I will be talking about non-celiac gluten sensitivity. Non-celiac gluten sensitivity is oftentimes abbreviated as NCGS. But first I'll touch on gluten-sensitive enteropathy. Enteropathy refers to a disease of the intestines, and therefore gluten-sensitive enteropathy refers to a disease of the intestines caused by the ingestion of gluten. And typically, when we refer to something as enteropathy, we're referring to damage of the intestinal villi, as Sarah talked about with celiac disease. However, the biggest difference between gluten-sensitive enteropathy and NCGS is that NCGS causes no damage to the intestinal villi. So we're not seeing any enteropathy, and we're not seeing an autoimmune response. I'll touch a little bit on the trend of gluten-free diets. I'm sure we've all seen the recent rise of gluten-free diets in the media, their rise in popularity, and I'll touch on that a little bit later. There is some speculation that NCGS could be caused by components of grains other than gluten. So the way that breads are processed today, components of yeast or other components of grains that could be the problem other than gluten. To start with the pathophysiology, the symptoms of NCGS are those that are similar to celiac disease and irritable bowel syndrome. So we're seeing a lot of symptoms like digestive upset and vomiting, diarrhea, but we're not seeing an autoimmune response and no damage to the intestinal villi. So that's the biggest difference. NCGS is defined as non-allergic and non-autoimmune condition in which consumption of gluten can lead to symptoms similar to those seen in CD. To start with the assessment, many of the symptoms are subjective, which can oftentimes make it hard to diagnose. Non-enteric symptoms of NCGS include foggy mind, fatigue, depression, joint and muscle pain, numbness, dermatitis, and anemia, and several of those are seen in celiac disease as well. The signs and symptoms can occur within hours or days of ingesting gluten, which can also make it hard to diagnose. And currently there are no biochemical markers that exist for assessing NCGS, so even a biopsy would appear normal, so we can't use that to diagnose it. The diagnostic criteria, it's diagnosed mainly through the process of exclusion, so you want to rule out the possibility of both a wheat allergy and celiac disease, which you would do through biochemical tests. Once those two possibilities have been eliminated, you can eliminate gluten from the diet, see if symptoms dissipate, and then later reintroduce gluten back into the diet to see if symptoms return to try to find a correlation. Double-blind, placebo-controlled studies are the most reliable methods for determining whether or not someone has NCGS, but unfortunately these are very time-consuming. They're for research purposes only, and you can't really apply them for a clinical basis. The only treatment for NCGS is the same as celiac disease. It's a strict gluten-free diet. And now just to touch on one of the many articles out there about gluten. This was an article from Time magazine titled "Eat More Gluten, Diet Fad Must Die." And today, many are attributing the gluten-free diet to the fads of the carb-free diets and fat-free diets that we've seen in the past. Marketers started labeling foods as gluten-free just to increase their sales, and as you can see here, there has been a very large increase in sales of products labeled gluten-free just in the past 4 years. And so much so that marketers are labeling foods that don't contain gluten in the first place as gluten-free, so dairy products, produce, things of that nature. However, eliminating gluten from the diet won't have any effect on weight loss or overall health if you don't have celiac disease or NCGS. So today, a lot of people are attributing their weight loss, their overall better lifestyle to gluten-free foods, but that may not be the case. They may just be eating healthier. So now Sarah and I will both touch on the medical nutrition therapy, which we've combined for celiac disease and non-celiac gluten sensitivity. To start out, the assessment will be quite similar. The anthropometrics, especially for celiac disease, you will see some weight loss due to the damage to the intestinal villi and malabsorption. The physical findings will often be similar. You'll see things like abdominal pain, diarrhea, fatigue, nausea, dermatitis, and anemia. Biochemical data for celiac disease, you will see positive tests for antibodies in the digestive system, but you won't see any reactions to biochemical tests for NCGS. The nutrition history for both, you'll see gluten-containing foods in the diet. Here are a couple of PES statements that you would use to diagnose celiac disease and NCGS. You'll see problems like altered GI function, again related to the malabsorption in the small intestine. And you'll see symptoms like diarrhea, abdominal pain that we mentioned before. And you'll also see inadequate vitamin intake due to the malabsorption of vitamins and minerals. In the intervention, you would want to focus on the carbohydrate modified diet because the only cure for both is, or not cure, but solution to both is the elimination of gluten from the diet completely. You want to implement nutrition education on gluten and its impact on the GI tract, so make sure patients are aware of the correlation. And recommend specific foods that eliminate gluten from the diet.
You'll also want to recommend some vitamins like A, D, B, and some minerals like zinc and calcium. Also discuss nutrition education for the patients with celiac disease. And with this, you will educate on how to detect which foods are gluten-free and what's not, and how to make some gluten-free choices. Monitoring and evaluation, you'll follow up with the patient to determine if signs and symptoms have decreased. During the follow-up, ask questions about their satisfaction towards the new lifestyle. And if signs and symptoms have not improved, you would want to implement more blood tests and implement a 3-day food diary to see if they're really following that strict gluten-free diet. Here is just a chart of the monitoring and evaluation, and we'll just point out a few things like the criteria. You would use the usual body weight to detect if they have weight loss. The goal basically is just eliminate gluten, as we've said before. And then you want a negative IgA TTG test for the biochemical measurements.
Alright, hey guys, I'm Mallory and I'm going to talk about tropical sprue. So basically what tropical sprue is, it's kind of a mysterious disease of the GI tract, and right now there's no known cause for it. They haven't found a specific pathogen that is leading to the occurrence of TS. One thing holds truth though to most of the cases is that they're finding a consistent contamination of the intestinal tract. So as far as where you can find it, kind of relates to the name. Obviously in tropical places, it's going to be about a 30-degree range from the equator, north or south. But within that range, tropical sprue is not found everywhere. So because of that, it's leading to some confusion and some controversy as to what the cause is. Some people say that it's genetic, and then other people say that it could be a geographic component. Some people also think that it could be due to cultural practices. A lot of people in those places have diets involving high fat and also ingestion of bacteria that could be associated with those places. So as of now, there isn't a known cause for tropical sprue. Here's just a visual representation of that map. So we have the equator, and then we have the 30-degree range above and below. In the most prevalent places that tropical sprue is seen would be these black areas, but mostly right here, which is India and Pakistan, where they can actually be seen in epidemic forms when it gets really bad. And not coincidentally, most of the research for tropical sprue is coming from India at this time. For the pathophysiology, TS can distribute the absorption of nutrients leading to several nutritional deficiencies, as well as abnormalities in bowel movements, which can lead to mucosal anomalies. TS is also an atrophic process that predominates in the jejunal and ileal mucosa, and that is where those finger-like villi are going to be flattened, which can lead to the appearance indicating partial atrophy. So here's two pictures as a visual. You can see the normal-like villi, which are much longer in length, and then this would be a patient that has TS. Those villi are much shorter and almost flat. So the villi help increase the small intestine surface area, thereby helping the small intestine absorb nutrients. So when a patient has TS, when those villi are shortened, the surface area becomes reduced and then absorption is decreased. So when that absorption is tainted with, then you have a possible malnutrition problem that could be occurring from tropical sprue. So for assessment, the main things we want to look at is the malnutrition from that malabsorption, chronic diarrhea, especially the excessive weight loss, and then fatigue, fever, things like that. Also, there's a volume depletion that may occur, so you want to check urea that may be raised, and also just see if the patient has been anywhere recently, like a tropical area, that they may have contracted tropical sprue. For diagnostic criteria, we're looking at those same things that we just discussed: the chronic diarrhea, abdominal cramps, weight loss, and if those things are seen, then we can do more tests to determine whether the individual has tropical sprue. Also, if they have deficient levels of vitamin B12, iron, folate, hemoglobin, or an increased fecal fat concentration, then that's also a big representation that they might have tropical sprue. As of now, the most definitive test is a jejunal biopsy, which would be where a doctor would go in and they would look at the biopsy and basically see those two pictures, well, the one that the patient has with tropical sprue, and you're looking for those flattened villi to indicate the disease. For treatment, they have about three main things right now: tetracycline, folic acid, and of course water and electrolytes, because a person that has tropical sprue is very dehydrated, and that's the one thing that really needs to happen quickly, would be to replace the water and electrolyte deficit. Other antibiotics and probiotics haven't really shown any promise, so they're not really dealt with right now, and there's no surgical treatment at this time for TS. For the MNT, again, we're looking for those same physical findings: your chronic diarrhea, abdominal pain, weight loss, as well as the deficiencies in vitamin B12, your hemoglobin, and things like that. A patient with tropical sprue probably won't see a change in their diet, so they probably won't be aware necessarily of that weight loss, so that's something that we really want to check for. And diagnosis, this is just an example of a documentation you could use for the patient: possible inadequate fluid intake related to those conditions, which would be that dehydration that is very highly prevalent. And a few interventions would be to recommend fluid and energy modification, as well as help implement initial nutrition education for the patient. That way they know how the disease relates to the diet and how they can help prevent it themselves. And also assist the client in identifying ways to self-monitor both signs and symptoms of the disease. That way if they see things that occurred, they can know to come to someone immediately. And then of course monitoring, evaluation. You just want to follow up with the patient as soon as you can. We want to check to see if any new signs and symptoms have occurred, as well as any recurring ones. And then based off that, how much the patient weighs and their height currently, we can see if anything else needs to be done, any additional steps should be taken. So this is just it kind of in chart form. I'm just going to point out a few things. So again, that excessive weight loss, we could look at by doing a 24-hour recall or maybe food diaries to help check that. And then we could just compare it to the acceptable weight for that person's current height and weight. And then physical findings such as the chronic diarrhea, which they could report themselves by seeing persistent signs and symptoms. And we can base that off of healthy bowel movements that would be normal for that patient. That about sums it up.
So in conclusion, we can see that there is a number of diseases that negatively impact the GI tract, not all due to allergies or autoimmune disease. There are still discoveries being made and research being conducted to better understand all of these disorders. But with any case, it's best to consult with a medical doctor or your registered dietitian to come up with the best diet for you.